Before I use the SonicFill to fill the cavity, I want to illustrate how the tip is placed onto the handpiece. It's merely screwed down until it locks in very tight. A couple of the instruments that I will be using right after the cavity is filled, and that happens extremely rapidly, so I want to describe this right now. You'll see the first instrument that I use will be a compo roller by Kerr, and it has different shapes of Teflon tips, and I'll use this to quickly roll the composite, if you will, adapting those occlusal margins and removing the excess. Immediately after doing that, which is only a couple of seconds, my assistant will hand me an instrument, a plugging instrument on one end and a blade on the other. Actually, this is from a kit of instruments that I designed for American Eagle. It's a posterior composite placement kit. And so I'll quickly use these three instruments to sculpt, carve, and shape. And that'll be a very rapid procedure as well. So this is why I wanted to describe them before we begin. One other note that I want to make is that when the procedure is being done, I will do the procedure with the light filter, the orange filter, over my LED light. So you're going to see a dimming of the light as the procedure occurs. And the point to note is how rapidly the procedure is accomplished in one bulk fill increment. Before initiating the sonic energy, I just wanted to illustrate the access of the tip into the bottom of the cavity. It has an ideal curvature, and I haven't been able to find any area of the mouth that I could not reach with this tip. I'm going to initiate this. This will be a very, very rapid procedure, and the cavity fills up literally like that in seconds in a single bulk fill. The instrument being used first is the compo roller to smooth and actually kind of adapt as well as remove excess. Next, I'll go to the American Eagle instrument, starting with the plugger to get a little bit more adaptation. I like to get my marginal ridge first and smooth that off down to the level that it should be, which is the opposite, the adjacent tooth marginal ridge. What I really want to point out here is the fact that the material at this point has not returned all the way to its uninitiated state. Easily carvable, very easy to work with and shape. And so there basically is it. And so now we'll cure the SonicFill using the LED Demi for just 10 seconds. Because of the depth of cure of SonicFill and the fact that the cavity was less than 5 millimeters deep, we only need 10 seconds from the occlusal. We'll augment that once we remove the matrix.